Today we're going to be talking about a common running injury, the calf strain. A calf strain occurs when some or all of the muscle fibers of either the gastrocnemius or the soleus are torn. Medical professionals rank the severity of a calf strain on either a grade 1, grade 2, or grade 3 scale. At any point during the rehabilitation progress for this injury, if you are feeling sharp or increasing pain, please rest and restart the process. Okay, we do not want to push through this injury and cause potential chronic pain for a longer duration of time. Immediately following a calf strain, you might be experiencing inflammation and inability to weight bear on that leg. First thing you want to do is to rest. You don't want to be attempting to stretch the muscle, as this may cause further tearing to the muscle fibers. Given that the two muscles, gastrocnemius, or gastrocs for short, and the soleus are placed right on top of each other and connect to the same tendon, sometimes it can be difficult to identify which muscle was actually injured. So I'm going to show you a technique that is going to differentiate between the two muscles and where the injury has occurred. To differentiate between the two injuries, we need to know about the anatomy of the two muscles. So the gastrocnemius runs all the way up from the Achilles tendon past the knee onto the femur. The soleus, however, runs from the Achilles tendon halfway up the tibia. So to differentiate between these two, we're going to perform a heel lift with the knee bent and with the knee locked out. We will go up against a wall and we're going to balance on the one foot. So we're going to begin with the knee straight. If I can raise up onto the ball of my foot on this side with no pain and come back down, we know that it's not the gastrocnemius. We can perform the exact same movement with a bent knee, and if this movement produces pain, then we know that the injury is to the soleus. If the heel raise with the knee locked out produces pain, then we know that the injury is to the gastrocnemius. If the heel raise with the knee bent produces pain, then we know that the injury is to the soleus muscle. After the initial inflammation has started to subside a little bit, you're ready to begin your rehab process. Now, the first thing you want to do is start to reduce some of the muscle adhesions that have occurred in the calf muscles. Now, we want to identify those tight bands. They're going to feel like knots in the calf, and we're going to do a little self-massage here. So what you're going to do is you're going to use both hands, pressing into the muscle, feeling for tight fibers. And when I find those, I want to press down, and we're going to do a little back and forth motion known as cross fiber frictions. We're going to work our way down the band and continue this until we feel that muscle release a little bit. Before returning to high impact activities like running, we must gradually increase the strength of the injured tissue. Whether that's the gastroc or the soleus, I'm going to be showing you some exercises that are going to help strengthen both of these muscles. The first exercise that I'm going to show you is a heel raise negative. So eccentric movements are great for rebuilding strength, especially to injured tissues. So the negative heel raise is focusing on the down phase of the movement. I'm going to lift up my heels with both feet and then slowly lower down on the one side. At the bottom of the exercise, I'm going to bring my opposite foot back on and raise back up again. I'm going to lift up with both feet, slowly lower down for 5 seconds. At the bottom of the repetition, I'm going to place my other foot back on, raise back up, and repeat. For the same exercise, to target the soleus, I'm going to lift up, bend my knees, and then slowly lower down. Lift up on the toes with bent knees, slowly lower down. It is normal to feel a little bit of discomfort during this exercise. However, if you feel a sharp or an increasing pain, then discontinue this exercise. Perform 10 to 15 reps with a 5-second descent, and make sure to do both sides even if you have a perfectly healthy other calf. Once the heel raise negatives become easy, we can progress to doing a negative and a concentric part of the movement. We can also add weight to this movement as well. I'm going to be performing the same 2 exercises we just completed with a dumbbell in my hand, doing both the down phase and the up phase. I'm gonna start at the top. My weight is on my one side. I'm gonna lower down, nice and slow, and then drive all the way up, squeezing my foot. Coming down under control, and then coming all the way up. You can also perform this exercise for the soleus by bending the knee. After seeing a gradual increase in weight on the 2 heel raise exercises that we've done, you can gradually return back to running. Now, you want to make sure that you ease back into this. Start by running smaller distance at an easier pace and gradually day to day increase your pace as well as your distance that you're running. I'd like to stress the importance of having a slow return back to running. If you progress through this too quickly and you start to experience any pain, please restart. Don't try to run. Don't try to push through this injury, or it can result in longer, more prolonged chronic injuries.